Did I see you
Uh-huh.
last year in Tobago?
Yes, yes,
In
yes,
July?
yes, yes. On your way back to, I
Trinidad.
think, there you are. I was in the airport. I came down
Oh,
to collect something.
oh, so you were leaving or going or just in the airport?
I came to the airport to do a quick collection and go back.
All right, all right.
Yeah.
Vic, how did
Because
stuff go?
I completely forgot about it, but my
Yeah.
sister remembered. I'm like, really? Let me ask him.
Yeah.
Okay.
All right.
Yeah.
Once Rene returns, we'll get started because I know Victor's time is valuable. Rene, where you going?
Victor,
Uh-huh.
what I want to know is how come you live in Tobago and on a Sunday night you only have 45 minutes?
Well, he's the head of Tobago boy.
So what
Tobago
happened
not
is,
busy, you know?
no, well, I still have
you
duty as a obstetrician gynecologist, and I'm on call for the week.
Oh, geez. Okay, okay, okay. So it's work then. All right, all right.
Yeah, yeah, it's work, it's work, it's work.
Because Sunday night is Sunday school, right?
Nothing happened across here, forget.
I don't know.
Yeah, nothing.
I
All
would
the
be surprised. Is Sunday school still going on?
no. Bars closed. So all those activities stop however long now.
know, Hugh, you come on here to my guy Victor.
Oh,
We're
no.
not gonna have none of that, Hugh.
We waited
Keep
on
it up.
Rene.
All right, a few more
I see
guys
David is,
joining.
yeah.
Valda is joining. David Marks, Campo. Um, I think Rene should be back. All right, fellas, we're gonna get started because we know Victor's time is valuable. So Dr. Victor Wheeler
Right.
is working at the main hospital in Tobago. He's a gynecologist there. He, like the rest of us, very concerned, very saddened by David's sudden passing. And in a chat that we had briefly with Victor last week, Victor has offered to chat with the wider group to talk about health risks similar to what eventually caused David to pass, but general health risks that we at our age could mitigate. So, Victor, over to you,
Right.
sir.
Okay. So I presume most of us are over the age of 55. So that puts all of us in a high risk group. Generally for lifestyle diseases, diabetes, high blood pressure, those of us who are overweight, all those things would affect it. And in the current scenario with COVID, we are all in high risk group if we were to contract it. So, but specifically related to what David had, which was it appeared to be a clot in the lung, a pulmonary embolus that killed him. That would have originated from what we call a DVT, or deep vein thrombosis, whereby it starts off either in your legs, your calf, or in your pelvis. And this is simply just the blood forming clots in your bloodstream. And most of you know what a clot is like. And that clot would break off and go straight to the heart and then to the lungs. If a big enough piece gets to the lungs, it blocks off the blood flow, and that is instant death. There is treatment available for it, but sometimes you can have a clot in the leg or a clot even in your lung, a small clot, and you may not know. So the focus really is on prevention, just like everything else. Prevention, living healthy. Prevention would be things like keeping the weight down, being active. Over the age of 55, it's important to have regular exercise. And the general rule is half an hour to 40 minutes, 3 to 4 days a week of cardiovascular exercise. This is actually important now for those of you who working from home, sitting behind a desk, sometimes 3-4 hours at a time. It's really important that you be active. So You really need to take, and it's more so now when we were younger. When you were younger, you're always all over the place, playing all kind of sports, running up and down. But as you get older, you have to make a deliberate effort to be active. And the general thing is 30 to 40 minutes cardiovascular exercise, 3 to 4 times a week. Regular checkups. I don't know if any of you all have doctors. If you don't have a general practitioner, you really need to have one to have your regular annual checkups. They talk about executive medical where you blood pressure, height, blood sugar, certain blood tests that you would do, heart tests, prostate tests, colonoscopy, which is a test for colon cancer. All of these things these are things they should be doing routinely over the age of 50. So really, there are some foods that you can take to help mitigate clots, but the rule of thumb is regular exercise, watch what you eat, avoiding excessive alcohol. We're not saying no alcohol, and specifically for clots, drinking red wine has actually been proven to help. So there's no harm having 1 or 2 glasses of wine with dinner or lunch. The rule is no more than 2 for the day. Red wine in particular is said to have some benefits with respect to cardiovascular health. It does reduce the risk of clots, risk of stroke, risk of heart attack. Eating certain peppers also helps, mainly because pepper is a sort of a stimulant. But the rule of thumb is really general exercise, drinking lots of water. They talk about 8 glasses of water a day. Fruits and vegetables, 3 meals a day to make sure you have a regular bowel action. Is really just general healthy living, which we all should be embarking on at, if not before, it's certainly not too late to start. So I might just want to pause and, anybody wants any clarity, things you want me to expand on a little more, because I really keeping it general, which is really the approach. There's no point anyone going and look to do a test now to see if you might have a clot in the leg. That's not that's not a good use of funds. The better thing is just to be healthy and adopt some of the preventative steps to reduce the risk of having the clot, but not just the clot, but general healthy living.
So, question, Victor, Valder here.
Yeah. Yes,
when you say cardiovascular exercise, how do you define that? Is there like a certain exertion level? You need to raise your pulse by X amount, or how is that defined?
So you have cardiovascular exercise and you have strength, muscle strength exercise. So the general distinction is lifting weights, which is not necessarily cardiovascular, as opposed to your body movement. So running, skipping, jogging, swimming in your particular case, cycling on the treadmill. Essentially anything that will cause your pulse to raise. Now, our average pulse should be in the region of 70, 80. Anything that should cause it to go over 100 and keep at that rate for the 20 to 30 minutes. And at our age, brisk walking is actually the safest and the best way to do it. Jogging, swimming, cycling. If you can't be outdoors, if you can have a treadmill at home or the stationary bike, would be actually quite adequate. And continue that exercise for half an hour. Specifically addressing the clot in the leg is where you talk about walking, skipping, jogging, anything that moves the leg. What I made mention to sitting behind a desk for 3 to 4 hours is important to either If you can stand every hour or so, or simply moving your toes. The act of moving your toes would encourage the muscles in your leg to contract, and that would increase the blood flow back up to the heart, which is really what you want to do. You don't want to be sitting and the blood is just there, stagnate. Some of you may notice if you sit by a desk for 3 to 4 hours, your feet might get a little swollen, your ankle might get a little swollen. The swelling of the ankle indicates that there's a little difficulty of the blood getting back to the heart, and you need to watch it carefully. So something, if you're sitting on the desk without a shoe, in your slippers, and look at your toes and feet after 3 to 4 hours to see if your ankles in particular are getting a little swollen. That's something you would need to check, because that's only normal in pregnant women. It's not normal in other persons. It's common in people who have heart problems, kidney problems, but the average fit person, it should not happen in. So that's a simple thing you can check for yourself.
If I may interject here, folks, good night.
Good night.
I see we have Valda way off in Vancouver there. Mr. Bechan in representing the
Eastern Canada,
along with Hugh Carter, Alan in Florida, and Ian Chin in Trinity. Well done, Ian. Who else is there? John Baroli. Anyhow, just a couple words of executive medicals are available at both West Shore and Good Health, which is near the stadium there. I am fortunate enough that the company that I work for sends me for one every year. So they have 3 different levels: bronze, silver, and gold, and they range from about $2,500 up to about $4,000. If you're doing ECGs and stress tests and all of that, it costs about $4,000 for the gold package. Blood work, they give you a very comprehensive report, and then you go in and you consult with the doctor. In about 2 weeks, when they give you the report, you can sit down with the doctor and go through each and every aspect of it as you see fit. So that is highly recommended once every year or 2. I tend to take the bronze every year, and then I think it costs an additional $1,500 to upgrade to gold. So every 2 years I'll upgrade. At our 40th anniversary of Class of 79, Dr. Gerard Fafa, I don't know if you all remember, he offered, we can't advertise, but he offered a 25% discount for all those who wanted to do the colonoscopy. He's one of the best in the country. He said very few have taken up the challenge, but he is willing. So any opportunity I get, I promote it for him, because he can't advertise as a medical practitioner. But he has all the protocols in place. He has his system set up well for since the COVID and all of that. Very simple procedure. You go in early in the morning, and by half an hour you're out. Get somebody to drive you home, and he offers a 25% discount for our class and family members. So highly recommended those of you who want to give him a call. And because once you cross 50, you really should be doing it. I did it about 2 years ago, and I sent my wife to do one this year, because I'm at the stage now where my wife and I, we give each other gifts of health. How much bracelet you're going to buy, how much, vacation you're going to have. Well, you can't vacation now. But basically, we give each other gifts of health. So executive medical, whatever the case may be. And at our age, I mean, I feel that's a suggestion I would make to many.
Yeah.
It's an excellent suggestion, Rene. We should all be doing regular medical checkups, as Victor is pointing out, and as you yourself are saying. And yes, I do remember Gerard offering that colonoscopy discount last year at the dinner. So yes, I too would encourage all of us to go out and get a colonoscopy. But I want to swing back to Victor.
Yeah,
Victor, just to recap on what you said, you talked
no, no,
about
no. Just a comment on what Rene said. I mean, I quite agree with him. The executive medicals would cover the areas quite well, and Gerard is among the best gastroenterologists in the country. He has top of the line equipment. So definitely, I would recommend that you take up the offer. In his case, he doesn't work in the public service, only privately. So, but generally, it's what I should say is that those in our age group, because of the risk we have, people are actually dying young from all the various cardiovascular diseases, heart problems. Right? I mean, in Trinidad and Tobago, diabetes and high blood pressure contributes the most deaths. I mean, people talk about COVID now, but diabetes and high blood pressure kill more people every month compared to what is happening now. And I think the fear of COVID does take a little bit away from the general advice we should be giving persons about regular exercise, watching what you eat, drinking enough water, doing regular checkups. At this stage, that's all you can do really about taking preventative steps and regular checkups. And as Rene said, at our age, it's really health. Health is really what you really want to be focusing on. Material things would not bring much if you're not healthy to enjoy them. So really, the things that you should have been doing in your 20s, 30s, 40s, we passed that stage now. So it's to see what you can do now to catch up.
Mm-hmm.
Those of us who have not been doing what we should. All right.
Victor, quick question. You mentioned eating properly. You also mentioned not too much alcohol. All right. Is there any other foods we should avoid? All right, to actually assist with the lack. Sorry.
No, there's no food. There are certain foods they say that help prevents the blood from clotting too much. The thing is, clotting is a normal experience, is a normal body protection that helps prevent you from bleeding. What you want is to keep a right balance. And the issue with clots in the bloodstream is really related to atherosclerosis or persons who have high cholesterol levels. And what this happens is that the bloodstream, instead of being very smooth pipes that the blood will flow through, you have these irregular jagged areas called plaques that causes blood not to flow well. And whenever the blood doesn't flow well, you get clots. So healthy eating would be avoiding red meat. We didn't say you shouldn't eat red meat. Anything that will cause your cholesterol level to rise. So red meat, what we say in particular, if you eat lots of fruit and vegetables, that would help prevent it. Red wine is said to be something that stimulates the cardiovascular system as a whole. Regular exercise, drinking adequate water, avoiding dehydration. There are certain people with cancers. I mean, over the age of 55, the likelihood of someone having cancer is increased. But so those persons who have cancer, just the mere fact of the cancer itself or the treatment related to cancer would increase the risk of clotting and would increase the risk of DVT or clots in the legs. So at this stage, if you were to ask what you need to do, if you've not had a checkup within a year, have a checkup. The executive medical that Rene spoke about is actually the ideal thing for those of you who can afford. There are health centers that do offer regular checks. They call them wellness clinics in the health centers that are free of charge, whereby they will check your weight, check your height, see if you're overweight for your height, check your blood sugar, check your blood pressure, check your cholesterol. And from these basic tests, that will then indicate if they need to do things further. So it's not always necessary to spend money to do it. The primary healthcare system in the health centers, and I want more to focus North Central. Those of you who live around Mount Hope Hospital, there's a St. Joseph Health Center that does that. But most of the health centers in Trinidad and Tobago will have a session where they offer wellness check, where you don't have to be ill. You can just go and make an appointment to get your routine checkup. At one time, they used to be marketing something called Know Your Numbers, and the numbers really related to your weight, your blood sugar, your blood cholesterol. I don't see them marketing it as much now, but it's still available in the health center system free. So you don't necessarily have to pay if you can't afford to pay.
So Victor, can you tell by your blood work whether it's your cholesterol or your blood pressure or anything else if you would be at an elevated risk of a clot?
No, there's no particular blood test, but the clots generally starts in the legs and the calf. So Trinidad is not a case where you have to have a referral to have a scan done. So you can go to those centers that offer ultrasound scan and simply ask for a Doppler ultrasound of the legs, which is really how they would test it. And what that is really using sound waves to look at the blood flow in the legs, and that will identify if there's a clot there or not. There's actually no blood test that you can do to say that you have a clot. But the ultrasound is a painless thing. It's just to rub some gel with a probe over where the blood vessels are in the legs, and in particular the calf. And it takes about half an hour to 40 minutes. It's not too expensive. Probably, I don't know, maybe about $500–600. But you can just go to one of these ultrasound centers and do that, if you're particularly worried about a DVT. With respect to the clot in the lungs, that requires a special CT scan, which, there are private places that basically will do whatever test you ask. You don't have to have a doctor referral, but it's always useful to see a doctor so that they will guide whatever investigation you have. You might go there thinking you want to check for a clot. Next thing, your blood pressure is high, your blood sugar is high, or you may have some other ailment that requires investigation. So I wouldn't generally just say go to a lab or go to an ultrasound center. I would just recommend seeing a doctor. General practitioner if you have one. If you don't have one, there are quite a few of these private places that you can see one, or there's the health center, at least in Trinidad and Tobago, health centers where you are, that you can get a checkup.
Victor, you've spoken a lot about mitigation, things to do to stay fairly healthy. I wonder if you could swing towards signs, things that are occurring that we should be concerned with. One that you mentioned was the swollen ankle. You said the swollen ankle is a clue that something is going on. What other signs should fellows our age be on the lookout for to say that says, hey, you need to check into this, as soon as possible?
All right. Well, when you go about your normal activities, so let's say you find that you walking up a stairs and you're getting short of breath where you didn't normally get short of breath. You can either be anemic or there could be a little heart problem. Chest pains, stomach pains unrelated to, now, some of you, I don't know, some of you may have constipation where you may not go off every day. Stomach pains not related to hunger is something that you need to check. At our age, prostate problems. If you find that you go to pee, you can't, the flow is difficult, pain with urination, or blood in urination, blood when you pee. With respect to colon cancer, blood in the stools. When you go to the toilet, number 2, blood in the stools. Even though those sometimes constipation when you're forcing, there might be a little blood related to hemorrhoids. At our age, any blood in the stool is something you need to get checked. And they do say that the colonoscopy is recommended over the age of 50. But going on the scale, checking your weight and checking your weight for your heights. There are not many of us whose weight is the same as when we left Fatima. So those of us who, your waist, if you just take a tape measure and it's more than 35 inches, that's a problem at your belly button. So just being overweight places you at risk with our age of heart problems, diabetes, high blood pressure, all the other chronic conditions, simply by being overweight. Teeth. We tend to ignore our teeth. If you have dental caries or rotten teeth, that is a risk factor for other health problems. So regular checkups with a dentist is also important. If you have bad breath, and you can ask your partner to check, we may not know, that's a sign that there could be a problem. You know, stink mouth is not just something that you would tease persons when you're young, but as someone our age, it's sometimes a sign that there could be something wrong with you. And at our age, to have dental caries is also a marker that there may be some other problems that you have. But aside from looking for whatever symptoms you have, that checkup where the doctor checks your numbers is really, really important at our stage. It's really important. I know Canada, I think you're in Canada, not so?
Yeah,
Right.
yeah.
So
A few of us here, yes.
Right. So they have still among the better healthcare plans, but what I do know from colleagues working there, sometimes the waiting times might be a little bit of a challenge. Mm-hmm. And if you have to have intervention, that might be a little challenge in terms of waiting, but it's still provided for you with your plan, so take advantage of it. Take advantage of it. In America, I think you have to rely on your health insurance. It's a little different, but I know there are hospitals that, unfortunately, those hospitals that would provide free care only provides emergency care. You don't want to reach a stage where you have to go to a hospital because of an emergency or a crisis. So you really want to take action beforehand. Hello?
We're still here. We're here.
Oh, okay, right.
Gentlemen, go ahead, ask your questions while we have Victor with us. Feel free, anything that you've been thinking about or concerned with.
Victor, Edward here. Is there a test for kidney function?
Yes, there's a simple blood test where they check the different electrolytes that would be a marker if your kidney is not functioning well. And there's one thing, the creatinine. Creatinine is a particular electrolyte. If your kidney starts to fail, it starts to rise. There is a urine test. You know, the doctor will ask you to pass urine in a cup or container where they check sugar and protein and blood. But that's a simple urine test and a simple blood test. Now, you could have problems with your kidneys because you know that you could lose a kidney and your kidney still functions quite well. So the mere fact that you have the test is normal doesn't always mean that everything is normal, because the kidney does have a very large reserve. So for those tests to show a problem, your kidneys have to be pretty badly damaged. But at our age, it's still worthwhile having that routine. They call it is a renal function test, a blood test. It's not very expensive actually. The urine test where they ask you to pee in the cup and just take put a little dab in it to check it. That is a marker, but it's not very reliable. The blood test is more reliable and more accurate of them.
But that blood test would be part of the normal annual blood workup that you get at the clinics?
They will do that blood test if you suffer with diabetes or high blood pressure. So in other words, you wouldn't expect it to be abnormal if you don't have any of those pre-existing conditions. And diabetes and high blood pressure would be the two things. The routine blood test would be blood sugar, cholesterol, and your blood pressure, weight. The kidney function test will only come in if you have high blood pressure or diabetes. It's not routinely done. In the executive medicals, though, that Rene spoke about, that is part of the blood work that they will do.
Thank you.
What's that, Rene?
One thing I'd like to add here, folks, we're hearing some very cogent advice from Dr. Wheeler, Victor, and he's talking about regular checkups, etc. Those of us who visit a doctor, I don't know, once every 6 months for a checkup, or when you're feeling under the weather, I know of friends or elderly friends and the elderly parents, etc., who, when they go to a physician and the physician offers advice and puts them on medication, they start skipping the medication, doing it every other day instead of every day, etc., etc. And basically, it puts them in a very precarious situation, because the medication, if it was supposed to be taken daily and you're taking it every other day, you're not getting the efficacy levels that were intended. And they take all sorts of advice from those that are not physicians. So you hear people saying, well, they're trying to wean off the tablets, the high blood pressure tablets, and all sorts of Aesop's fables, as I call them. And they end up harming themselves even more. So if you're under the care of a competent, trusted physician, and they give you advice, and you feel you want to not take that advice, you need to go, if the medication isn't working for you or isn't, you go back to that physician and let them again advise. You cannot turn into what you call a Google doctor, do some research and decide, well, I'm taking half the medication, or I'm taking it every other day, or I'm cutting down the dosage. Because really what you're doing is harming yourself even more.
Yeah, actually, on that point, Rene, there's a huge market for alternative medicine. So just as you say, people go to a doctor, you'll get medication. Sometimes the medication you have a little, may cause a little nausea in the beginning, or you're getting medication for blood pressure, you check your blood pressure is normal. Then you hear some friend who went by this person who gave them some thing to drink or some tablets, or you hear these people advertising that I will cure you of your high blood pressure and your diabetes. You don't have to take that, and or you could drink some special water, you know. And the thing with it is, these persons who market these, they say it's all natural. It's not artificial. And they have a powerful cell. So when you have this medication that might be causing a little issue when you now start to take it, and it might cause a little headache and so on. And look, this thing, they will tell you it's poisoning you. These drugs are poisoning you. You will go to these alternative people and they will tell you they have this machine and do one blood test that will tell you 120 different things, and we can guarantee. When I first came back to Tobago, I came across one of these persons who, this lady came to see me, but she was going to this person who was giving her this thing that she had a growth on her breast, and this thing was drawing out the disease, drawing out the thing from her breast, and she was spending lots of money. Came by me, and when I examined the lady, she had a florid breast cancer. I just said that started to say, these alternative people, when you go to them and they give you all this advice, and when you get into real problems, you end up going back to the same doctor. The doctor, we as doctors, our biggest failing in this is that we don't spend time to counsel the patients. Some doctors just looking to hustle out of the office to see somebody else and don't take time to sit down and explain and counsel. But those who are embarking on alternative medicine, that is their big, strong point. They will sit down and listen. Sometimes a person just wants you to, they just want you to listen to what they're experiencing. And I have to say that is a big failing on some of our part. There are some doctors who will spend the time, but I know myself, sometimes you have 20 people in a clinic, 25 people, 30 people you're trying to get through the clinic. So you may not spend as much time. Sometimes even in a private office, you have people walking in, but really and truly, that is the big failing some of us have in not spending time to explain issues that the person may have with either the treatment, medication, and because somebody else is willing to spend that time, they may tend to have more confidence. And those persons can advertise television all they want. Doctors can't advertise the same way, but it's acknowledged. Some people who are started on medication and they're feeling good, the numbers looking good, the blood sugar looking good, they say, I don't have to take this all the time. And as you said, they try to wean themselves off it, not realizing it is by continuing the medication that your blood pressure or your blood sugar remains normal. Now, there are times when, particularly those who are overweight, if you lose weight on the medication, there are times you could actually wean yourself off or be weaned off. There are times that you might start off being slightly diabetic, borderline diabetic. You watch what you eat, you exercise, then your blood sugar drops. You don't always need to be on medication. Same thing with blood pressure. But the feeling that some of us have is really that counseling that we should be doing, that we don't always take time to do. Rene spoke about the executive medicals. I think in those situations, usually they are either general practitioners or so that will go through all the results and spend time. If you have a doctor who spends time and explain what's going on, hold on to that one, because it's really a feeling some of us have in not spending time to explain the worries or concerns that patients will have when things are not going the way that you hope, or you need to change direction, change approach, change medication. The counseling part of it, we sometimes do fall down a bit with. And it's a difficult battle because those who, if John Borrelli is still on, there was a time both of us used to be involved with Noni, which was supposed to be one of these miracle food supplements. And there are several other products that persons will market. And what essentially happens is some of them do have a benefit in terms of your well-being. Some of them are a little bit of stimulant. Some of them do offer some protective benefit. And the hard sell is really a good hard sell, because you have one or two people who, what I see happening is a patient would more rely on a friend who says, I took this and it made me feel good. They will put more weight to that than a doctor who says, look, if you do this, this is what will happen to you. And with Dr. Google being there available for everybody, where you can check. Unfortunately, Dr. Google also has many imposters who put information for you to access to sell their product, and it's not always easy for someone who is not medically trained to sift through all the information that you have there. Google generally can give you good information about your condition. I use it myself for some medical conditions, but you have to know the source of the information that you're tapping into. And the danger of social media comes in, where it's very easy for someone just to write an article with a particular aim in mind, and it sounds good, and people take it as gospel. It's really difficult now to sift through what is fact, what is fiction. But a lot of information is available now. It's up to you, the individual, to use your common sense and try to sift through.
Hey, Vic.
So, yes.
A question. Well, a comment that probably, as you mentioned about the kind of levels of conversation and interaction that tends to the difference between traditional doctors and these alternative people. One of the things that I find, and it's not just an observation of other people, it's something that happens with me as well, in that there's hesitancy sometimes to go and check out your issues because of a fear of finding out something, all right? And the level of confidence that people have that if something is found, that something could be done, I think is something that people need to wake up to, that generally medicine is something that can treat these things, you know, and there's a fairly, there's a level of competence in modern medicine that people are not aware of, you know. I don't know if those kinds of things need to be addressed by the medical community as well, you know.
Yeah, I know. Actually, I will say, comparing 30 years ago, I mean, I started practicing medicine, I qualified in 1987. The kind of conditions that 30 years ago you just didn't have a hope that we are treating now is phenomenal. And I'll also say people criticize the public health system a lot, but the kind of treatment you're getting now for free was not available 20, 30 years ago. People get certain cancers. Okay, we have the ability to identify cancers much earlier now than we did. Some cancers is still a little difficult, but the surgery, the chemotherapy, the radiotherapy, there are some cancer treatment now that you would not know that person is getting treatment for cancer. Gone are the days where you automatically feel you will lose all your hair, you will look old and haggard. There's lots of new, some of it expensive, but medicine has advanced that the things that previously we were not able to treat, we're able to treat now. Persons can get artificial hips done in the public sector. You could get a new knee. I don't think we've done any heart transplants, but you do kidney transplants. Places abroad, you can get your heart, you get your kidney. Some places, women get the uterus transplanted. The technology now for treating has advanced plentiful. What I think personally has not, certainly in Trinidad and Tobago, I'm not sure what it is like in Canada, what has not kept pace, and part of that is the pressures of being in the public service, is the time to sit and speak and counsel patients with the doctors, which I think does contribute sometimes when things don't go well and people complain. But if you really pay attention to what a lot of people complain about, a lot of them complain about waiting in casualty. You may get complaints about persons not speaking to you well, being rude. But the vast majority of persons who enter the public system do get actually good care. And all the medication is free. All the treatment is free. But having said that, the preponderance of alternative medicine, which comes in the form of things to drink, tablets. There are persons who say they will just take a blood test and tell you whatever they have. There are some doctors as well who cross over, traditional doctors who also involve in alternative medicine. The other thing not to discount is Chinese medicine, acupuncture, and the various Chinese teas that Western medicine tends to shrug, turn the nose up at. But some of these things actually do work. But it's really for somebody who is, we all have access to information. The fact that you could be on Zoom and you have access to internet information, and having gone past fifth form in Fatima, you have a certain minimum level of education. The difficulty and challenge we have is to try to sift through all the information that is bombarding you. And it is a lot. It's really a lot, and that's difficulty.
If I may interject here before I make my departure, folks. We have a nice network here that we have developed, courtesy of David, of course. But one of the important things, and John touched on it, is doing your research in terms of all of us may have a friend that is a doctor or two, and we have Victor here, we have Dr. Fafa, and one or two others who would have been in our here. Have a chat with them if you have an issue, and I'm sure they can point you in the right direction as to who are the best in the field in Trinidad and Tobago, I can't talk about outside, but they would generally have information, correct me if I'm wrong, Victor, as to who would be someone that you can refer us to. Because I can tell you, there are a lot of snake oil salesmen out there, particularly with your alternative medicine. And you also have some medical professionals who are just running down the dollar and don't really seriously care about patient care. And I can tell you, my personal physician, who I've been going to for probably 20 years now, Dr. Richard D'Souza in Diego Martin,
Yeah.
he spends a minimum of 10 to 15 minutes with me, no matter how simple my ailment is. I may go there for a sore throat, and he would sit down, want to hear about the family, how you're going, pulls out your medical records. He's not a computer guy. He has all these cards with him, and he can go back. You were here 3 months ago for this, and he goes through it in detail. And that is what Victor was talking about in terms of having a physician who really cares about the patient. And no matter how many people are in that waiting room, if I go to that waiting room and I see 3 people, I know it's 45 minutes minimum I have to wait. If I go there and I see 5 people, that is an hour and a half I have to wait, because I know he is not rushing people in and out of his office. And that is what Victor is saying. You need to latch on to someone who is really interested in you as a person, and that's where they develop the loyalty and the care and the history, because they can go back and see everything that was done over the last 20 years.
Yeah,
I have to depart now, folks. It was an invigorating session. Good to see you guys again. I've seen David Marks on. I've seen Thomas came. I saw Thomas yesterday at Fatima. I see Terence Coonan there, Edward Camp. Right. So have a great night, guys. Thank you very much, Victor. And I'm sure we'll be in touch.
Yeah.
Rene, thank you very much for your very valuable contribution here tonight, because you've added some words of wisdom to along with what Victor is saying. Victor, just to recap, you gave us some points, some tips as to how to lead a healthy lifestyle. You also gave us some signs to look out for, and you said something that I wasn't expecting tonight. You gave full support to the public health system in Trinidad and Tobago, and I felt that for me as an outsider, and from all the things I hear about the public health system, I found what you're saying is quite remarkable, and I hope the guys here, particularly the Trinidad-based guys, can take something away from what you were saying.
I can attest that I use the public health system and it does work. You just have to have a lot of patience. Literally have to have a lot of patience, but it works.
The commonest complaint is the length of time you have to wait. And actually, I would probably suggest recent developments where persons do have access to income, losing their job is going to be under more pressure. But the public system is free. Because it's free, there's great demand, but you do get attention. You might come across the odd person who might skin up their face, and but that is actually the exception rather than the rule. Reason I'm saying this now, I've been in the public service since I've been back, and a lot of effort is being done to improve the relationship, the interpersonal skills, to try to make the person's experience a little, I don't want to use the word pleasant because you're going to the hospital sick, but at least to try to reduce the stress level. And the health centers, and I'll stress again, the health centers do offer a lot of services that people only realize when they actually go there. Some people feel casualty is the only place that you should go, but the health centers in your area do offer a wide range of services all of them have wellness sessions where you can just go in and get a checkup. Not because...
If somebody doesn't know where those wellness sessions are, can they go online to find out where they're occurring?
Actually, Ministry of Health does have a website that you can go on, and that website does have all the health centers in Trinidad and Tobago. They obviously would prefer that you go to a health center in your area, and all of those health centers would have a telephone number to call, actually. And I think it's a website that is updated regularly, and they do offer, some of them would have a session where they're doing pap smears for women, prostate checks. They do sometimes have outreach. You don't have as much outreach now because of COVID, where they don't want people to gather. But prior to COVID, they would go into certain communities. They would have a caravan that would go in. They would go into the workplace and do checkups, various things that they would do. But you as an individual can call and make an appointment, or just once you know where the health center is, you can just go and ask.
Victor, can I add that some of these health centers are actually open late into the evening?
Yes.
There are morning and evening sessions that you could go to.
Okay.
Yeah, they call them walk-in for any little, and a lot of that is done to reduce the burden on the accident and emergency department. We really don't want persons with a little toothache to go to accident and emergency. There should be a health center or a walk-in service that you can go and check that.
All right. Now, Victor, we have run over the time that you have allotted to us. Are you okay to stay on for a few more minutes in case the guys have questions?
Yeah, I can stay on for another 5 minutes or so.
Victor, let me throw one at you. Now that we exposed the computer monitors and cell phones, any advice for the eyes and so forth?
It's actually more for your back. Your posture when you're sitting behind the computer is actually important. I think a lot of the screens now will come with some sort of protective thing for the glare. I don't know that long ago you used to have to put a sort of a protective screen on the computer. I don't think you need to do that now. But what I think is more important is your posture when you are sitting. Sit in a comfortable chair with your back straight. And also, as I said, try not to be sitting for 3 to 4 hours at a time. What has happened to is because of people's work at home, lots of Zoom meetings, Zoom discussions, you have fatigue taking place, because your home is now your work environment. And some may have a difficulty creating that separate space for work and home. Prior to COVID, for those you would leave home, you go to work. When you come back home, that's it. But now with lots of things being online, where you work and where your home is the same thing. So being able to have some separation, I think, is important. Whether it is you have an office space at home, it's important to have that dedicated just for work, and the rest of your house for whatever activity. But try to avoid having your workstation being like a dining room table.
I have a question. Hold on, Beach, hold on a second.
Yeah, go ahead.
I know I came on late, but recently, I think it was Monday, a friend of mine, a Fatima boy, 52 years old, was exercising around the savannah and got a heart attack and died. He had 4 stents put in for one artery. He's been fine and well and been exercising for the last, according to one of his best friends, well, actually his best man at his wedding, he said for the last 26 years, every single day they've exercised around the savannah and through the botanical gardens. Then that day, what they do is that when they finish exercise, everybody go their separate ways. And he wasn't feeling well, so he left a little early. And then he, apparently about a mile on the road, walking home, he got the heart attack and died. So I asked him, I said, what signs, what symptoms? Was he ill? Was he sick? Did he do any tests? Did he do, all this stuff? He said, listen, December he went, he did all the tests, all the blood work, everything but that dye test. I don't know what they call it, Victor. When you put the dye in and you see the artery.
An angiogram, would have been an angiogram.
I think he did one in December, and he said he was fine. Everything was fine. He said his blood work was fine, his heart was fine, his lungs were fine. And a little less than a year later, the man gets a heart attack and dies, exercising, eating well. Now, when they talk about the public sector health, I have a big grief for that, because I have several people who work for me who have been to the hospital, and I had to take them to private hospitals because they were getting misdiagnosed. And my secretary, now her brother-in-law, passed away, and she was diagnosed with 3 different things. He was diagnosed with 3 different things, and then she passed away, and they still couldn't tell her what he passed away from. But forget that. Back to this gentleman with the heart attack. What do we do? The man did all the tests, everything. What is there to do again?
So there's no guarantee,
I understand, but you go, you get your dye test, the arteries are open, this, that, and the other. It's scary.
What religion are you? Okay.
I see.
Okay, the human body, what doctors do, doctors aren't magicians. What we can do is identify when there's an issue and either give advice or give treatment. But there's still so much that is unknown for what happens to us. And I am a Christian as well. And I have seen situations where I've dealt with somebody that I'm sure they're going to die, and they don't. And there are other situations you've done everything the way you're taught, and things just don't work out correct. And that is how I approach that. There's only so much you can do. All you can do is do what you can, follow the advice that you can, and the rest is up to God.
Kalito, let me ask you, said that he put in stents?
4
stents. That means he had an existing problem.
He had a problem too.
Right? So it's not that it happened all of a sudden. He knew that they had a problem. And
oh yes,
we changed his lifestyle. I just yeah.
But having said that, there are persons who would have had checks, nothing is wrong, and you go and exercise and drop down dead.
Good Lord.
Sometimes people have, you might have heard there was spate of young footballers or athletes.
Yes.
Right. There's a thing called cardiomyopathy, where there was a problem with the heart because it was often a heart condition where there would not have been any signs. Sometimes they may have been. Young people these days, when you get a little shorter, but they might just associate it with being exercising and not being fit. But there are occasions where you can just suddenly develop an infection in the heart and it kills you. But what I said about religion is that medicine is not an exact science. Doctors are often like detectives that use clues, and you come up, you just made something about diagnosis. Sometimes the clues point to 2 or 3 possibilities. You then have to use what information you have to determine what is the more likely of these possibilities when given treatment. And to be honest with you, sometimes the treatment, even if you use the correct prescribed treatment, sometimes it works, sometimes it doesn't. You got to operate to you had the information before that this thing needs to be removed. You go, you cut the person, and then you realize that what the information you had available, this is not correct. And what you see with your naked eye is different from what the images from ultrasounds and x-rays suggested it would have been. And that is just one fact that one just has to accept.
No, you see, sorry, go ahead. You go ahead.
The unknown in some of it is, that's why I asked what religion you are. Because there are times I have to say a prayer. You have to say a prayer.
But I think some of it locally, and I don't want to just isolate it locally, because foreign doctors can also have the same problem. The same guy who was giving me the rundown of the boy who passed away said his mother had a similar situation. She went to do the same angiogram dye test in Trinidad, and it was fine. The doctor analyzed it as being fine. Then she went to the States and she wasn't feeling well. So she did another test in Florida and she was 99% blocked. In the same artery that the doctor said down here that was fine. Now the doctor down here wasn't a public doctor, it was a private doctor that he chose. So that, I always believe in a second opinion.
Yeah, sure. And I mean, the thing is, but let me just make a comment. How shall I put this delicately?
You're amongst friends. You don't need to be delicate.
There are some doctors who would give you an honest second opinion and say what that doctor told you was correct. There are several who, because the private work is fairly competitive, want to keep you as a patient. And will tell you the doctor you just saw was doing rubbish. I don't know the personalities involved, but there are a few who will give you an honest second opinion, and there are others who just want the business.
I understand, but ultimately she had to do open heart surgery, and they found that it was 90% blockage.
Yeah. So I mean, I don't know the individuals, but I'm just saying that is also a fact, and there has been a preponderance of private institutions in Trinidad over the past, let me see, from about when Imbert was minister, when John Rahal was Minister of Health, is when the explosion started. Because up until that time, the RHAs were mindful about outsourcing services privately. And that started under John Rahal, and there was an explosion of private institutions. And they are in certain people's interest to ensure that these institutions flourish. And as a result of that, the public sector was looked on negatively. And some persons, because of their need to get business, would deliberately say things about the public service. My difficulty is that when you have someone who doesn't have means, feel they have to force and go and get a bank loan or sell something to go to a private doctor. The private sector should really be for those who can afford, and the public sector for those who can't afford. And when you talk about this second opinion, it's fraught with all sorts of things that aren't necessarily ethical. it's fraught with it. So that is just what I want to say. Now, the vast 99% of persons who go to the public service have no problems. But there are situations where things go wrong, just like with anything else. You could go to a private sector and you have a problem. And then persons who have private...
One little thing I want to disagree with you on. One little thing. You see the public health system, all of us should be subscribing to it. You know why? Because when people of privilege use something, then what happens is that standards have to raise, standards have to be, what's happening is because it's undersubscribed by people who have influence or whatever to help make a difference, things get ignored. So I actually think that it's our duty to use the public health system.
No. Yeah. And we do see people of means using it.
Yeah.
The thing with private, it should be free, it should be your choice. You shouldn't have to be forced to use it. That is my
agreed.
It should be a choice.
My phone about it, guys. I had to go. Vic, real nice seeing you. Sorry, but I had to go.
Right. John, always a pleasure, John. Always a pleasure.
Take care, John.
And I think with that, I need to sign off too.
Okay, Victor.
Thanks a lot, Victor.
All right, Victor.
Thanks, Victor.
Victor, I did have one more little question for you. Just give me one more.
Well, there had to be part two.
I wanted to ask briefly about, you touched on the differences between working in general and working since we're on COVID. And what you got me thinking about was mental health. Do you have any tips for us as to how to maintain a good mental health equilibrium particularly in these times?
Well, the thing is to, personally, I find lots of persons on the computer screen or on the phone, and you just have to identify in your mind what you can do to relax.
Well, set a hard stop.
Yeah?
Set a hard stop. It's just like if you're at work at 4 o'clock, you have to take a train or jump in a car to pick up your child. So work stop, all right? Yeah. So try and do the same thing at home. Set a hard stop at the beginning of the day. Yeah. And when that time reach, stop.
Yeah. But what also helps is identifying something that you can do to relax yourself.
And here it is, see? It's called photography.
Yeah. So whether it's a book, whether it's a game, whether it's taking a little stroll, whether you need to identify in yourself what you can do to relax, to get your mind off work. Because work and home is the same environment, it becomes even more important to identify whatever that is. And 10, 15 minutes out of every day, what you said about, what they call it, a hard stop?
Yeah, a hard stop, yes.
So that is just to try to separate the work from home. But you still need to have something that you can do to relax, to identify whatever it is. And that will help to preserve your mental health, which has been found to be increasing challenges with mental health, with persons being at home and isolation, not being able to get out and about like before. So identifying something that you can relax is important.
Excellent. All right, Dr. Wheeler, we'll call it a wrap. We just want to say, Victor, on behalf of Class of 79, thank you so much for your valuable time and all of this relatable experience. That, gentlemen, this session was recorded, so we can always play it back after. Yeah, I don't know if any of you took notes, but we could always have a second look and listen to what Victor said again. Again, Victor, remarkable. Thank you so much.
Thank you very much.
Cheers, Victor.
Okay,
Victor. Okay, Victor. So Vic. Hey, look, Warren, boy. Okay, Vic.
Sorry, Vic.
So, gentlemen, I will now stop the recording.
Thanks.